Can I welcome members, officers and members of the public viewing proceeding online to today's meeting. I'll ask now for Peter Seddon from Democratic Services to check members individually in turn to ensure we can be seen and heard.
Thank you, Chair. So just taking them in the order on the agenda sheet. Councillor Alison Clark, please.
Yeah, hi. I can hear and see everybody.
Thank you, Alison. Councillor Angela Coleman, I think, has given apologies. I think she's still in another meeting. Councillor Jane Corbett, please.
Hi, Peter. Yep, I'm fine.
That's good. Thank you, Jane. Councillor Elizabeth Hayden, please. Just try that again, please, Elizabeth.
Right.
Yep, I can get you that time. Got you. Councillor Tim Jeeves.
Hello. Yep, all good.
Thanks, Tim. Councillor Nick Small.
Yes, I'm here.
Thank you. Councillor Calvin Smedder. Doesn't seem to be here just yet. Oh, you're there. Right, I can see you now. Can't hear you though. Can you try that again? No, can't hear you, Calvin. Okay. Okay. Well, hopefully your sound will pick up as we go on. Councillor Emily Spurrell.
Hi, yes, I'm here. You hear me?
Emily. Councillor Richard Kemp, I don't think he's here. Councillor Sarah Jennings. Thank you. Go to our advisory members now. Councillor Dorcas Akiju, please. No, Dorcas doesn't see, and she did email to say she would be here, so expect her to come along soon. Hazel Brown, please.
Peter, I'm here. Yes, thank you.
Thank you. Sarah Thwaites.
Yes, I'm here.
Right. Okay. So you got my link just now. Our cabinet members, Paul Brandt's given apologies. So Councillor Claire McIntyre as assistant cabinet member.
Yeah, thanks, Peter. Hear me okay?
Yes, I can. Thank you.
Fine.
And our mayoral lead for mental health, Councillor Ros Gladden.
Hi, I'm here.
Thank you. I think that's all our members. So officers will just bring in as we go. Thank you, Chair.
Thank you, Peter. Before we begin proceedings, I want to say a few words. The whole country has been shocked and appalled over the death of Sarah Edward. No woman or child should have to fear walking on the streets alone or at any time of the day or night. Can I ask this committee to take a minute to reflect on the loss of Sarah and the thousands of women killed, harassed, injured, and hurt by men each year? Okay, thank you. Okay, so can I just request that members and officers leave your microphone on mute during the meeting until you want to comment? Can I also ask officers to turn off your webcam unless you are addressing the committee? When members or officers do wish to speak, you can either use the hand up feature or by attracting my attention on the screen. Peter, have there been any notification or apologies of absence?
Yes, Chair, from Councillor Paul Brant and from Councillor Angela Coleman. Thank you.
Okay, thank you. So, item 2, declarations of interest. Can I invite any declarations of interest from members and officers? Please unmute and indicate if you have one. No indication. So we move to item 3 on the agenda, mental health impact of COVID. At previous meetings, members of this committee would remember a number of questions have been raised by members in relation to support for mental health as a result of COVID-19. As models of support have to change due to lockdown, changes in people's circumstances due to job loss, furlough, bereavement, isolation, and family pressures. I requested this extraordinary meeting to receive reports and presentation produced collaboratively by the CCG, Mercy Care, Adult Social Care, and Public Health. Before we receive this presentation, can I invite Councillor Ros Gladden, Mayoral Lead for Mental Health and City Wellbeing, to address the committee. Councillor Gladden.
Thank you, Chair. Yeah, I really do welcome this meeting. It's much appreciated. We've got some problems to overcome. So my 3 objectives going into this was the training of our employees in mental first aid. The intention of the Mayor was to have a mental health champion in every workplace that staff could go to or who could identify stress within that particular workplace. The reduction of the suicide rate in the city. So the mental health 5-year forward plan set out an ambition to reduce suicide rate by 10% by 2020-21, and that was against the 2016-17 baseline. Clearly, COVID has happened in between, so that's an objective that's going to be very difficult to meet. So whilst I understand that while suicide rates in the neighbouring boroughs around Liverpool has declined during this pandemic, it appears that Liverpool may have increased. And I'm sure our officers will touch on this during their particular presentation. So the Joint Strategic Needs Assessment was the other objective that we have. We've never had a mental health Joint Strategic Needs Assessment to help with commissioning. So we completed one in January 2020 with the very clear emphasis that this was a work in progress. We shared that primary document with the Health and Wellbeing Board, the Suicide and Mental Health Working Party, and with this committee. And that was over a year ago. However, I'm not entirely sure how far we're up to with this, because it clearly needed revision. And I'm pretty sure that the CCG and all our other health partners were involved in dealing with this. Training. Before COVID hit, we've managed to provide 2 different training courses for councillors on mental wellbeing and the identification of mental ill health. Both those events were well intended, and there were plans for more to take place in 2020. Clearly, that didn't happen. I've also been trying to access some online training that we'll go to, but I'm hoping we'll be able to lock down before then. I'd also discussed this issue with the Chief Executive and how we could take forward the Mayor's plan for workplace champions, and that was really important. We had a really good discussion around that and how staff could be supported within that role. Clearly, we haven't got many workplaces at the moment anyway. So part of my year this year has been trying to stay in touch with many of the independent organisations in this city, and I'm not going to go through them all. I'll just mention a few. There are places like Imagine, Sean's Place, James's Place, the Football Hub, the Everton in the Community. All of these organisations have done great work this year. They've stepped up to the mark. It's been very difficult for them because they are obviously very often face-to-face organisations, but on this particular case, they can't do that because of COVID. So a lot of them have had to change the way that they approach this work by doing it with inclusion, digital inclusion. I will say something very important about all this. Inequality in the city is still massive. And we used to say that a child born in Everton tomorrow would live 10 years less than a child born in Chilwell. And that is still the case. Our this COVID has made that situation even worse, I suspect. And the implications of COVID on mental health are going to be felt worse by those organisations, those areas where they are the poorest, where they have lack of security within employment, lack of financial support, where they've been they've been at home and can't go out anywhere, or they've been home tutoring. All those things are going to impact very severely. I've been really proud of the way a lot of our councils have stepped up to the mark during this, providing additional services, things like food hampers and all the other things. There is nothing worse, from my point of view, than being a mum on her own with kids and no money. And once furlough stops, once that stops, that situation is going to be very, very much worse. We're going to have real problems. Now, it seems to me that all the indications Merseyside have done a modelling up to say that we're going to be really badly affected. That isn't happening yet in quite the same way as we expected it to. So, but there is a lot of trauma. So the trauma teams higher up are being affected. So the police team that goes out with mental health trauma, there's a high increased demand for them, something like 84%, but not necessarily with the lower ones. And I think that's possibly because people don't know how to access it, the lower support, and also because the digital inclusion could be difficult. So I'll just say this about inequality and how it's going to affect us. So there's a moral imperative that we have to make sure that the health in our city is available to all, whether you're poor, whether you're rich, whatever. And there's a legal requirement. The Health and Social Care Act in 2012 placed responsibility on our health partners to demonstrably take account of inequalities in access to and the outcomes of healthcare. That has been ridiculous. It has been really difficult over the past decade, given the amount of cuts that social care and public health have experienced during this time, and the CCG and our healthcare service. We've been very lucky that people have been able to step up to the mark, but we can't expect this. There's going to be a lot of problems once we come out of this. And I think we've all got to be careful. This report that the officers have done is absolutely excellent. I will say something else just to finish. Next year, I'm up for election in May 22. I'm not seeking re-election, so I'm standing down. I also intend to stand down as the mental health champion, regardless of who's the mayor or whether they want one or whether they don't. I think it's really important, given the problems that we're going to have in the next year, 12 months, that there is going to be somebody available who can do this job, who can give more than a year. I can only give a year, and I think it needs somebody else. I'm happy to help anybody who's there doing it, but I think, on my point of view, I have to stand down and give somebody else an opportunity to make this work properly. So I'll not say anything else. I'll ask the officers to introduce their report, and I'm happy to answer questions at the end. Thank you, Chair.
Thank you, Councillor Gladden. So can I invite the officers to do the presentation, please?
Oh, thank you, Chair. I think I'm going to take the first slide.
Okay, bear with us as we get it up.
Yeah, we have the first slide. So thank you, Ros. My name's, just to introduce myself, my name's Janet Bliss. I'm a GP in Walton. I'm the clinical vice chair of Liverpool CCG. It's going to be a bit of a team effort today, just kind of just with the slides. So what we wanted to do today really is give you an overview of the issues raised during the pandemic and how we've tried to come together as a system to work in partnership to address these. It's been outlined kind of how severely the pandemic has affected the mental health of our people, and I don't think we've seen the half of it. So this slide, I'm not going to really kind of go into detail here. This just gives you an overview of the kind of the elements that can have an effect on somebody's mental health and well-being. The next few slides are, we've decided to, rather than rehash all the information in the report, we've decided to try and kind of look at key groups within the Liverpool population and the key factors that affect them and what we might be doing to mitigate it. So, as I say, it's going to be a joint effort between CCG colleagues, Merseyside colleagues, and City Council colleagues. So if we go on to the next slide, and I can hand over to Melissa.
Thanks, Jan.
Janet, can I just ask you to pause 1 minute while we get the slides up and running full screen? Thank you. Just a bit of technical issues.
So can we have the next slide, and I'll pass over to Melissa.
Okay. Yeah.
Right, thank you. So I'm just going to give a brief overview of some of the impacts that are detailed in greater depth in the report regarding the community impacts. So the impact of COVID on the mental health and well-being of our communities and families has already been devastating, and I think it's already been said by Jan and Ros that we haven't really seen the full extent of this going forward, but already we have seen increasing levels of anxiety, depression, post-traumatic stress, and we're currently investigating the increase in suicide, death by suicide over the last 12 months. There are key points that we need to be particularly vigilant for in Liverpool, and we are already seeing a massive impact in terms of our communities. These have been mentioned already in the introduction. So levels of unemployment, we've seen an increase over the last 12 months. We are likely to see a further increase once furlough ends, and as a result of that and job insecurity in the market, we're likely to see income reduce in our already many vulnerable households. The consequence of this in terms of mental health and well-being relates to the poverty stresses, and that isn't just going to be about the financial envelope, that is going to be about the impact that households will feel as a result of living in poverty. Over the last 12 months, we've been working really hard as a system to try and mitigate some of the impact of this on our families. We've been working using our existing services. So our Liverpool Citizen Support Service has seen a 74% increase based on what we saw 12 months ago in terms of support. And we have a number of other services that we've invested further funding in, even when we've received national funding, because it isn't quite even then meeting the needs that we're seeing within our population. We also have new services put into place which are COVID specific and looking to mitigate some of the impacts that we're seeing as a result of COVID. So, for example, we've got our NHS track and trace payment system, which offers a payment support element to families. And again, although that's been nearly £1 million that we've spent on that, we've had to supplement that with further funding because it hasn't quite been able to stretch far enough compared to needs that we've had. And we do know that based on very rigid national criteria that we've not been able to successfully process many of those applications. And so we've been able to support individuals through other routes on that part. Behavioural patterns have changed during COVID, and that has been consistent across all ages, but we are seeing some behavioural patterns that have been really negative for mental health and well-being, and some of them we have already mentioned previously. So domestic violence has increased during COVID, and we are working really hard with our partners in the local authority to support survivors of domestic violence. We are also adding into existing services an element of being able to work in a COVID-safe way. So if we look at other behavioural patterns that have changed, we've had an increase in smoking, drinking during COVID, substance misuse, and many of those services that were already operating had interruption in service delivery, and so were unable to reach people who needed support, or people who were receiving support were unable to continue. Those services are now operating in a COVID-safe way, but we are having to put in, and we have put in, recovery plans to be able to reach those individuals that may have had a lack of support in that interlude. We're working to get people timely support, and at Liverpool City Council we've set up a COVID support line, and that's a support line that enables people to access support as a result of challenges that they're facing in COVID. Now, that could be isolation, but it does have a wider remit to it, and it does support our shielding population. That's very much a partnership approach in terms of a support line, and we have referral pathways set up if people are in need of mental health support. We refer people on if they're experiencing fuel poverty or food poverty to places where they can receive support and help there. And in addition to that, we've set up a number of specific contracts for providing mental health support to our population in terms of lower level mental health support needs, and that includes a bespoke service that's offered by the Samaritans, which offers a callback element to that service in order to provide timely support for our residents, and a online counselling service that is available to our residents, which we have initially targeted at 5 key groups. That includes survivors of domestic violence, individuals that have been working in frontline services for health and social care, and a number of other high risk sectors. But both of those services are available to our wider residents as well. We've seen a significant impact in COVID in terms of our deaths. So 18% of deaths in Liverpool have been related to COVID or as a direct result of COVID, but we've seen about 20% overall excess deaths in Liverpool. The impact on that on the individuals and families will have been significant because we haven't been able to go through the usual rituals and processes that we would normally go through in order to be able to cope and grieve in the ways that we've done previously. And as I've said previously, just a few moments ago, that we've seen an disproportionate impact on some of our workforces who will have been at the front line experiencing high levels of deaths in their service delivery. So in addition to what I've mentioned previously in terms of the Samaritans, we've also been working with our community voluntary sector to reach out to members of our community to offer them befriending services and bereavement services during this time to help them cope with this. We've had a significant impact, as I've mentioned, in terms of population impact, and this has deepened our social inequalities. Our approach has been very much about making sure that people have been receiving services proportionate to their needs, and we are recognising that this needs to be in place as part of our city recovery plan. Embedded already in one of our pledges going forward is the need to recognise mental health resilience and to tackle suicide as a city. Thank you. Next slide.
Okay, thank you. I think this is me and Tom presenting this slide. So this is just to talk about people who have long-term conditions, and by that I mean conditions such as high blood pressure, heart disease, diabetes, COPD. So we knew already that people with chronic health conditions do have an increased risk of being affected by mental health conditions such as anxiety and depression, amongst others, and that kind of was the case before COVID. COVID has obviously exacerbated this. I think the impact of shielding when people kind of were extremely socially isolated for months on end, and that's obviously worsened people's mental health, and also the actual just worry of actually whether or not you're going to get COVID. I think people were absolutely terrified, and the anxiety levels that kind of were just about manageable before have kind of been tipped over by the stresses and the strains of the last year. This obviously kind of negatively impacts on their physical health. Kind of Melissa referenced, kind of worsening, kind of eating habits, alcohol use. Also, lack of activity. With the best will in the world, even if you're working from home, you're just not as active as you are when when you are going out to work every day. I think that's true for all of us. So I think that all of these things have had a negative effect. I think also to talk about people who've survived COVID. So, and this doesn't just manifest itself in kind of long COVID, but also kind of the short term effects on somebody's mental health of being especially hospitalised with COVID. And there's quite a high incidence of PTSD and related conditions that we're seeing. But services have responded in a kind of proactive and collaborative way. I hope colleagues will be aware of the Ways to Wellbeing service that's provided by the Citizens Advice Bureau that provides support for people. They provided great support for people who were shielding, contacted them and you know, kind of proactively reaching out to kind of make sure that their needs were being met. There was also great collaboration shown around rehabilitation services, which teamed up with mental health services such as IAPT to support people just initially when they're coming out of hospital with COVID, but also kind of people with longer term problems. And the rehabilitation services really redesigned their offer, if you like, to because kind of people couldn't, you know, kind of face to face appointments were no longer possible, especially with people who are at higher risk. You know, the service reconfigured their service, so they offered a mixture of home visiting, telephone support, online resource, and occasionally video consultation. It's also been there have been specific IAPT kind of pathways to address the needs of people with long-term conditions. So I think there has been some real innovative partnership working to try and support people. And we need to continue kind of learning from what we're doing, find out what works best and change it and move on if necessary. So I'm going to now hand over to Tom Fairclough to talk through the rest of the slide.
Yeah, thank you. Just to echo some of the issues raised by Councillor Gladner initially. Well, we've got people who are disadvantaged. What we've seen over the last year is a further worsening of that disadvantage, and I think that's working in two ways. One is in terms of the economic consequences, which we've still yet to see the full impact of, but also in terms of mental illness as well, because those who have pre-existing conditions seem to have fared worse than those that went into this particular situation in a healthier mental health state. We know the psychosis has risen across the city, more so than in other areas as well. And it's not surprising really in terms of some of the triggers for something like that relate to stress, isolation and so on. We also, we're picking up in terms of crisis services, and this is through the police, it's through other partners, through Merseyside, that people are engaging with crisis services for longer periods, which suggests that the situation they find themselves in is worse than a year ago, effectively. And initial figures suggest that suicide has increased in Liverpool more so than it has in other areas of Merseyside. We're still working on the data with this, and we're also going to see whether that's something that's been echoed in places like Manchester, Birmingham, etc., to see what's actually happened. We also have an idea about where that is in the city, gender, age, and so on. But obviously that requires a little bit of work to understand what's gone on. And what we're trying to do is be proactive in terms of some of the solutions. So working with James Place, particularly in terms of some of the more deprived areas of the city, with some outreach work with partners like the football clubs and so on. And we've also got the opportunity to reopen Liverpool Light, which closed this time last year because of funding issues. I suppose we've been fortunate. That wasn't necessarily intended, that the investment that we made in 2019 and 2020 was in place, and not just the money, but the people were recruited to be able to respond. So when there was a need to put an urgent care line in place, we had the response in place in Liverpool and Sefton as well. And it also got the community developments, some of the investment that went into psychosis. So in some respects, we were fortunate that we had a workforce to respond. Workforce is an issue and it's a challenge, and on that list there you can see pressure on mental health beds. There's more demand for those beds, but also we've been affected, or Merseyside in particular, have been affected by the fact that you get outbreaks within patients. You also get outbreaks with staff and shortages with staff, and that's provided a real challenge over the last year. There seems to be lessening a little bit now, but throughout the year, staff, particularly at Merseyside, have worked really hard to keep the engine going behind the scenes, because at the top of the pile is the need to admit people into beds if they're not safe in the community. There's a lot to mention there. There's a lot gone on, and there's a lot happened in terms of response. But I'm sure Merseyside colleagues would want to chip in at the end of their slides appeared towards the end of this. So I'll hand over to the next slide.
Hi, Martin Farron. I'll run you quickly through these slides. What we have seen, and I don't think it's a great surprise, is people with disabilities have been disproportionately affected. We've seen in particular the issues linked to loneliness, and obviously a significant number of them have comorbidities. So they've ended up shielding, which has meant that for many of them, a feeling of isolation. We've seen a greater burden on carers, particularly elderly carers, as many of the people would have accessed a range of other services, but have obviously been at home 24/7. In learning disability overall, we have done some work in the Northwest, which is recognised, I think it was nationally leading in looking at what's called rapid reviews, but there was a disproportionately higher number of deaths in learning disability in residential care, higher than older people. But I think on a positive note, what we have seen is the opportunity to target support, particularly across the way in which we've managed day services. So we've seen mental health services provided online, still doing some face-to-face where necessary and appropriate. PSS have had an online support and have very much linked people to existing services such as food offer, advocacy, carer support. And Richmond Fellowship had some European funding through the Social Fund to develop podcasts which have been widely used. We've also seen the council providing advice through its own processes, particularly for those who were shielding, and making sure that people were able to access practical support as well as emotional support. Next slide. This slide covers quite a large group of people, often people with quite significant challenges. One of the key areas to highlight is that in the initial wave of COVID, we didn't see a particular increase in domestic abuse. But as we went into wave 2 and 3, we have seen a growth in domestic abuse, so that the number of calls have gone up by 20%. And the police are certainly much more engaged around some of that. We've also seen a real risk around homelessness, with 1,000 people presenting to the council for emergency accommodation. We've ended up accommodating an additional 250 people. At the same time, we have had some success, which many members will be aware of, in moving people on into permanent accommodation, but the numbers coming through are still extremely high. We have seen issues for people accessing a range of services because of obviously the face-to-face nature, and many people don't want to go into services, and that includes around drug and alcohol. I think these are services which are more difficult to be provided online, and we've certainly seen a drop in the numbers of people accessing reablement. All these things, I think, for people with very complex lives, mean that they end up feeling quite marginalised and isolated, because contact is often a challenge in the first place. And many of them don't have the ability to go online easily, but equally they're not people who are comfortable with that. So we are looking at a range of ways in which we support people. In terms of as I've already mentioned, mental health services, we have seen a different pattern, and we've been able to provide people with support. Again, asylum seekers, really challenging, because many of them have been left for some time without their cases being processed, and that's created anxiety for people about what their future arrangements are going to be. And there is a concern that as we come towards the end of COVID, that there's going to be a significant movement of people whose decisions have been delayed. We've also seen significant changes in the way in which people are being resettled and moved into accommodation, and as there are some successes in that we've been able to use some of the issues around Property Pool Plus to target people in the most needy groups, so certainly those in domestic abuse and homeless people. Okay, if I can hand on to Trish and Elaine.
Thank you, Martin. My name's Trish Bennett. I'm the Director of Nursing and Operations for Merseyside. And I'd like to just alert you to some issues for our frail elderly people, those living with dementia and people at the end of their life, who we've also seen a significant impact on. And certainly we've seen excess deaths, particularly affecting this group. We, in our care homes and residential homes with people with dementia, we've seen issues around isolation, causing agitation, confusion and emotional distress. The absence of familiar faces or a touch from a loved one, obviously compounding this and adding to this distress, both felt from the loved ones themselves, but obviously from the residents and their families. We've also know and well documented seen the toll of deaths in large numbers, and for people, large numbers at the end of their life. The impact that has both on the residents, or on the staff, and the mental health. And I think it links back to Roz's point about trauma at the beginning and the opening of this, and grief and mourning at such a large scale. The support that we need to provide for each other is clearly a task for all of us involved in this. We also seen some very, very, very positive things in collaboration in this city. And, you know, for one example, around enhanced support for our home care residents, certainly the collaboration with our PCNs, with the CCG, Liverpool CCG, with City Council and with Merseyside, work that we will want to build on and continue, working together to support people in this very difficult situation that we would generally want to build on together in that collaborative way. And people at the end of their life, again, working with our PCNs, the City Council and the CCG in a very strong partnership with the patient and the public at the centre of this. So some very positive things in a very dark and challenging time. We've also seen that borne out in Martin's slide around the disabilities. So for our population with learning disability, for our population that's housebound, when we've started on the vaccination programme, we've done that together, and we've reached out to our housebound and our population with learning disabilities. In fact, I think over 400 people already vaccinated in the city. So really positive examples of collaboration in a very challenging year and time. I'll hand over now to my colleague, Elaine Derbyshire.
Thank you. So if I can take you back to, I think, Janet's initial slide, which talked about the biopsychosocial approach to mental ill health. Oh, the slides have gone. There we go. You've got the different biological drivers, psychological drivers, and social and environmental factors often involved in mental health conditions. And this slide aims to sort of show you the things that we did in health in the NHS to factor in all of these different areas in terms of the care that we could offer during the pandemic. So if you look at the stage one things of, obviously we needed to adapt all of our services quickly so that they were COVID safe. We immediately switched to counselling online via a tool called Attend Anywhere. Obviously that has impact in terms of digital deprivation, but we try and factor in face-to-face where appropriate and safe, as Martin said, as well as digital, and lots of the mixed response in terms of people preferring digital consultations, and some people prefer face-to-face. So hopefully when we come out of this and start to talk about our next stage in recovery, we have a bit of a blended approach. We significantly improved and widened our community provision to make sure that as many people as possible were able to stay well and at home, so that they didn't need a hospital inpatient stay. Important to keep people connected to their communities, and having a lot of dormitory accommodation at Merseyside, we had to reduce our bed numbers as well. So we wanted to make sure that we kept our beds free for those people who really needed it. But really that community provision was an absolute support in terms of helping people live well in the community, particularly at a difficult time such as the lockdown and the pandemic. So we then moved on to our life rooms provision. For those of you familiar with our life rooms, turned our whole curriculum and all of our offers online. So we now have a full range of interactive courses. We have a range of access to pathways advisors, advice for health, for debt, housing, other issues. We tried not to limit any of that because of lack of face-to-face. We've also introduced a number of new programs to help people eat well during lockdown. And I think if you cast your mind back to food shortages at the beginning, we had all sorts of creative ways of helping people eat well and stay well. We launched our urgent care hub, which was a 24/7 a first response line, which was absolutely crucial for people in crisis. We also did quite a lot of work with something called a MAST tool, which is basically our clinical services, profiled our service users, and we're able to reach out to them clinically in between what would be their normal appointment regime to make sure that they're supported, and we're really targeting the support that we could offer to those who were most in need and most vulnerable. And that was then layered with the same approach, but from our life rooms team, who could reach out and look at any social prescribing. What else could we be doing to help people in wider social and non-clinical areas? We also improved our IAPT provision, the short Liverpool provision, for people who might have needed community counselling. And then moving into the later stages of lockdown, we moved into our Cheshire and Merseyside Resilience Hub for staff, because clearly our staff have worked, as lots of people have worked around the clock. It's been a difficult time. It's been a very challenging year for us all. So putting that psychological and health and wellbeing support in for staff has been really important, and that's now opened across Cheshire and Merseyside. We layered that in Merseyside with enhanced support for health and wellbeing for our own staff, and we've been growing our life rooms social prescriptions. The life rooms works best with its 130 plus community providers. So if you think of life rooms as sort of the Spotify, it's the platform, and then our community partners are very much the artists online that we link in with, because that's also another thing for us to support wherever possible our community providers, our charities, our third sector organisations who found it very difficult to fundraise in this over the past year. So that sort of gives you a flavour of what we did throughout the different phases of the lockdown up until today. If we can go on to the next slide, please, Peter. And this just gives you an idea of the range of services that we've launched. And we've promoted these quite widely through social media. So people have always got somewhere to ring, somewhere to make contact. Our urgent mental health support line, which is open to anyone aged 16 or above. It's 24/7, it's free phone. Same for the psychological support line for lower level psychological conditions, Talk Liverpool, as I've mentioned, and our life rooms provision. So this is publicly available to anyone who might need it and who might have experienced higher levels of stress, anxiety, or our own service users that might have needed some additional support. I'll hand you over to Trish now, who can talk more widely about the broader range of Merseyside services. Thank you.
Thank you, Elaine. Could you have the next slide, please, Peter? Thank you. This infogram just gives you some understanding, I think, of the impact on our mental health services and our community services with some examples. I think it's important for us to understand the impact on NHS services as well as others. So during a very challenging period of managing outbreaks, supporting the staff through this process, of course, the demand doesn't change that much, and our beds have been around 95% occupied consistently through the COVID period and the different waves that we have experienced. I think in terms of infection, I would like to say that the work that we've done together with the City Council, our Public Health Department and ourselves in terms of managing outbreaks in nursing and residential right across the city, again, a very strong example of collaborative leadership and work. And just to pull out a couple of points here, a couple of examples. So our crisis resolution home team handled over 3,600 calls in the last 3 months. Our district nurses, the non-face-to-face activity for this month, we're up in January by 143%. Our walk-in centres saw a 13% increase. We're starting to see pre-COVID demand in all of these services actually above pre-COVID demand. We're seeing that in a lot of services now. Our MWAS car, with our MWAS service, our mental health triage car, 359 people seen since October, and that resulted in 63% of avoided admissions into A&E. The discharge work that we again have worked very collaboratively with Martin and his team, with CCG and with our acute trust, our Luft Trust, 487 discharges just into the ICRAS team. So that's our integrated care rehab team. But much more than that we've done together. And phenomenal work that's gone on. I think you can see that obviously for yourselves. I think the other area I'd just like to draw attention to is the telehealth, with over 2,000 people being supported since October with oximetry at home, which is, again, that support to people in that very difficult time where they are positive. Managing to keep people at home is very important, and also that support that they can give. So I'll hand back now, I think, to Melissa. Thank you.
Thanks, Trish. So the penultimate slide is a summary of information that we have available. So the front diagram is if you like, a PDF slide which is available, and we share with colleagues. It's also available online as a kind of point of access for information, starting from self-help and how people can access services regarding self-help, through to talking therapies, and then urgent care self-help. And we currently have this available in 11 languages, and we're just increasing that to 16 at the moment. So that's something that we can make available to people if they want it for their constituents. In addition to that, on here is some of the materials that we have available to Liverpool City Council employees. So on the right-hand side is the mental health and well-being, and that's our intranet. And on there you can see there are various elements that we've made available and developed in order to support our own staff who, as noted at the beginning, have been working, like our colleagues on the call here from other organisations, been working really hard during the pandemic. And we are in that offering support and training for managers to recognise stress and to support people during this period, interventions to help people cope if they are struggling, and various other support elements available to our staff. On the left-hand side is the cover of a resource that was made available and is made available to our health and social care staff. So it's a really comprehensive directory of service supports that are available for them to be able to access and to use, and in regards to mental health well-being. So we have a number of resources available, and this is just a kind of snapshot of what we have. Thanks. I'll move on to the next slide, please. I think it's Councillor McIntyre.
Thanks, Melissa. So just to sum up, really, how essential us as councillors are rollers as well. And you'll be aware that there are 8 next steps in the report But these bullet points just highlight a few areas that we as councillors can help with. But obviously, it's not an exclusive list. So prevention and early intervention is everybody's business. And, we can all access things like the local government association will put out training schemes, and we need to know what to do really, and recognising that need, and just breaking down the stigma around mental health and death by suicide. And again, we could access the training that Zero Suicide Alliances has put on, which I've done, and it's very helpful. Understanding key issues across services, communities and families. So like we're doing this, all the time, feeding back on issues and supporting dialogue and communities with families, and we're signposting those in need, and we're doing that all the time. And then recognising different COVID experiences for our residents, for the inequalities that are going on there and differential impact on mental health. And again, we all do it. We advocate for vulnerable groups locally, regionally and nationally, and we draw out potential issues. And we're good at signposting. We need to carry on doing that. And then joining up our approach and partnership working. So supporting a Liverpool partnership approach with shared accountability systems for mental health and suicide prevention. Thanks. And thanks, Peter.
Okay, thank you everyone for that presentation. Can I now invite members for any questions in relation to what was presented? Councillor Jane Corbett.
Thanks, Chair. Thanks for that. That was really fascinating, and it's to be able to look at one issue that has so many facets to it, and how I think, okay, there was a couple of things that really struck me. One was that obviously it's a double whammy, having austerity for 10 years and now COVID on top of that. However, the COVID situation has actually meant that everybody's had to change so quickly. So just thank you to all your staff who changed and thought right outside the box and collaborated together and thought, how can we wrap this around and respond to individuals and families and households? And that's been quite extraordinary across the city in true Liverpool style. The thing that really strikes me is the issue around chronic stress and the causal factors that increase chronic stress. So I'm not talking acute stress, I'm talking chronic stress. So the old, one of the leaders in public health in Scotland some time ago, he talked about lack of power and control plus unpredictability equals chronic stress and anxiety. And I think there's something, if you look at your the ways forward at the end on page, well, I'm not sure which page it is, I haven't got my number now, but the next steps, that section at the end, and linking it back into the social determinants of health and looking at the pressures, particularly around inequality, which everybody's referred to. I'm wondering if we could add into there or expand there, certainly in terms of number one, where we're looking at what the information is out there and the data sets. Could we use the protected groups within the Equality Act, including the socioeconomic disadvantage there, and also look at the intersectionality there, where things just cross over all the time, and look at that really, really carefully. So we're looking in particularly in terms of economic inequality, where people are trapped and they have no power over their own situation at the moment. That may be in work or out of work, as we're coming through the coming out of COVID. So I know quite a few of you referred to the increase in the use of whether it's food banks or particularly citizen support scheme, which we've managed to keep going in Liverpool for many years now, and the increase has been quite extraordinary. I mean, in April 20, so that's this time last year almost, we had a 185% increase in people accessing the emergency grant system that we have. I mean, that is off the Richter scale. and that was just, okay, it flattened down then, but it still was massively increased, but 185%. So I'm looking at the impact of chronic stress on children and teenagers and adults, and how that plays out. And I think I think the way that we could share how that actually works in your mind, what impact that has, physically, sociologically, would be really helpful. And I think that's one of the things that's almost missing with down the years has been the looking at chronic stress. It has so many link ups with food, with sleep, with relationships, with ability to make your own decisions. And just finally, to go back to the Marmot's set of 6 recommendations with Fair Society Healthy Lives, because in our Marmot community, I'm just reading it off the wall of my laptop stuck on the wall. The second one, enable all children, young people and adults to maximise their capabilities and have control over their lives. And then number 4, which of course the government since 2010 have refused to agree to, sadly, and immorally, which is ensure a healthy standard of living for all. And then we look at some of the causal factors and we move forward. And just a big thank you to the CPNs that have been out and about in the community, because I know from my own experience of residents here where they've just kept that relationship in place, and that has made a huge difference, where people trust their CPN or their whoever it is that they're linked up with, particularly around mental health, and the Ways to Wellbeing. It's just amazing. So thanks so much to the Ways to Wellbeing guys as well. Cheers, Natalie.
Thank you, Councillor Corbett. Can I bring in Councillor Tim Jeeves?
Thank you.
Yeah. You're on mute, Tim. Brilliant.
I think I clicked it about 5 times then, going back and forwards. Yeah, thanks, Chair. Just a couple of questions, really, just to clarify in my head, really how things are working, perhaps sort of at the first port of call, or actually within the community. The 2 questions I've got is one about the triage car, which I saw from the report. Am I right? Is there more than one, or is the one that's done, is that the one that's being run by the police? I saw there was one mentioned in the report. There's like the police triage car.
Tim, there's more than one.
Right. But there is one that the police are.
There is. Yes, there is one. Yes, that's a different one, Tim. Yes, but yes.
Okay. In terms of how that works, are the police in uniform, or because I'm sort of aware that the police are often having to pick up mental health incidents and absolutely not criticising what they're doing, but I've also heard people have said that if you're having some kind of mental health crisis, to have someone come along in uniform is obviously likely to add to your distress. I was just wondering how that works.
Yes, they are, Tim.
Right.
They are.
Yeah.
Were you going to come back on that, Tom? I saw your.
Yeah. Can I bring in Tom?
Just a very quick one. I've been out with the triage car a few years ago, so it's quite interesting. So there's a uniformed police driver with a mental health support worker, and they will arrive on the scene where perhaps police or ambulance are there already. Similar with the NHS car as well. So it's the extra mental health support within that car as a first response. But they are uniformed. But the mental health support worker is not in the same uniform, obviously.
Okay. Thank you for that. And then related in a way to that was with the talk about the working with the community providers. I'm not sure if that data is actually available, but do we have a sense of how those the different community partners that we have, how they're sort of, how does that match up with the areas of need? I suppose that as Ros said in her introduction, there's this massive spread across the city that ties in with issues around poverty and other forms of deprivation. So I'm just wondering, is there sort of a fairly even spread in terms of the community partners, or are they located in particular areas as well? Do we know?
Who wants to take that question?
I'm not sure what you mean by community partners. Which?
Sorry, there was some talk, wasn't there, about the different community providers. I think it was like slide 8 or 9. I can't remember where it was on that. I sort of made a note about it, but someone was talking, saying that it was about the linking up with different providers in the community. Maybe I misunderstood, but that was something that I thought someone was talking about.
Bring in Councillor Ros Gladding, who's indicating. Yes, Ros?
Yeah, just I think, Tim, you're talking about the organisations, the independent and the voluntary organisations that I talked about previously, and that some of the staff, the officers have also mentioned. There's a good spread across the city in terms of those organisations, and they tend to be very mobile, so that anybody can access them at any point. So it doesn't matter where you're geographically based, you can access them. But I mean, obviously, if you say somewhere like Everton in the community, it sounds like they're just in Everton, but they've got a massive range all over the place. And the services that these small organisations offer have been really superb. They've picked it up. So I think one of the difficulties I've found is that they don't necessarily talk to one another, but they may talk to some of our officers. But there's been some excellent work done by them over the past 12 months.
Okay. Thank you, Ros. Can I bring it? Tim, is that okay for you? Your questions answered?
I did actually have one more, if I may, Chair.
Okay, I'll let you in on one.
Thank you very much. Just to sort of ask as well if there's any plans, because I know that there's a lot of cultural activity planned around the 23rd of March to mark sort of the first anniversary, if that's the right word for it, of lockdown being introduced. And I know that there's this plans for Marie Curie are pushing for a national day of reflection, and there's a minute silence and things like that. And this was talked about in the chambers. It was a motion for me and Sarah Morton to sort of be looking at this, and the opportunity to just be using that day to really be communicating. I think some of the fantastic stuff that's been going on. There's going to be a lot, I think, in terms of council comms going out. And it may well already be well in hand, but it just seems a very good opportunity in a week's time just to be sort of pushing out some of this stuff so that people are aware of it, because there's going to be, I suppose, a lot of reflection on the fact that this last year has been really hard for an awful lot of people in a lot of different ways. So yeah, just wanted to flag that up, really.
Yeah. Martin, can I bring you in, and then I'll bring in Alison, Councillor Alison.
I think that Councillor G's raised a really good issue. I mean, obviously, the issue that we need to make sure that we get is a balance of the learning and all the positive work that's gone on. And I think certainly speaking to some of our colleagues in the NHS who work across a wider patch, what they are reflecting is some of the work in Liverpool has been far greater, proactive and great joint working, which is not to mean that we rest on our laurels, but it is a real opportunity for us all together to have a look at services. So I think that there is a lot of learning that we want to have. I think we do want to recognise the fantastic effort that's been made, including by communities themselves, lots of the voluntary sector, and lots of people just in their own families, particularly carers for me, have played a fantastic role, which they always do. I think, they're part of the unsung workforce, really, in that Liverpool's a very caring place and families have stepped up during this period. So I think there's a lot to do on that, and it's not going to just be on the one day, because I think some of the learning we need to be looking at now to reshape some of the services. The sad thing is, and I say this in a slightly controversial way, it has also highlighted maybe some of the things that we did previously that we don't want to go back to doing, because actually some of the things that we're doing now are far better than what we did before. Some carers have found, I'll use carers as a good example. Carers not having respite has been a real problem for many carers, but there's also lots of carers who've said, actually doing lots of stuff online has been fantastic. It's opened up a world of support that I couldn't access before because of my caring role. So it's like getting the balance right, I guess, Tim, that we need to do. And I think members will definitely need to feed into that. I don't want it to be a one-day thing, because I think there's lots of learning, good and not so good, that we need to reflect on and actually make sure we learn.
Okay. Thanks, Martin. Can I bring in Councillor Alison Clark, please?
Thanks, Chair. I had a couple of questions, please. So the first question was just really, within the report, it was noted that lower level interventions weren't being taken up as much as Merseyside had expected, and it's hypothesised within the report as to why that might be. I suppose what perturbed me a little bit about that was the fact that serious mental illness has been an increase. And also, you've mentioned about suicide rate increase. And in the report it says, where you hypothesise as to why this might be, these lower level interventions might not be working. So I just wanted to ask a little bit more about those interventions and how they're being evaluated, and why, there's that suggestion that they may not be working, and why people aren't accessing them, because it said that they haven't even reached pre-COVID levels, which I thought was interesting. So the second question was, I noticed, I think it was Elaine Derbyshire talked about attend anywhere. And within the report, it mentions that only 7% of consultations were via attend anywhere. And I found that surprising, really. And I would have thought that the attend anywhere platform was preferable, particularly in sort of mental health provision, to telephone contact, given, the increased ability to see somebody's, facial expression, body, kind of, communication and all of that kind of thing. And indeed, I think they mentioned that some people have expressed a preference, and I know from my own experience working within the NHS that some patients have actually found it far less stressful to be able to have a consultation, online in that way, rather than having to come somewhere. And given the COVID situation, I was a bit surprised really by this low level of the use of that platform for consultation. So I wondered if somebody could comment on that, please.
Yeah, can I bring in Tom?
Just in terms of the common mental health disorders, the IAP service, just to say, there's probably two things we measure, or three things we measure: how long we wait for a service, or people wait for a service, how many people access the service, but also the recovery rates. Now, the recovery rates have been strong and have improved, so those who are accessing the service are the recovery is good. I think the number that's probably we were talking about is the number of people who actually come forward seeking support. And I think there's two things going on there. There's a balance between the need for the service and people's reluctance or willingness to come forward at this particular point in time, given we're in lockdown. There was an improvement in terms of access rates in the autumn as things eased up a little bit, but I think people are a little bit more reluctant, and there's still a lot of people coming forward to access the service, but not in the numbers. We're talking about previously something like 15,000 people in Liverpool coming forward to access the service, but it's quite understandable that some people will think well, I don't really, you know, for lower levels of anxiety and depression, they may feel at this particular point in time that they don't feel the need to come forward in quite the same way as they did previously because of concerns over infection, obviously. Obviously, the Merseyside have been looking at what's going to happen once the concerns disappear, and we do anticipate that there will be a build-up and that there will be an increase in the numbers coming forward. But it's human behaviour. It's difficult always to predict the balance between those two forces that work for need against desire to come forward or willingness to come forward.
Alison, if I bring you back in, and then Trish, you wanted to come in.
Thank you. So
yeah.
Tom, just on that, you were saying about reluctance to come forward because of infection. I suppose my concern is that people are perhaps reluctant to come forward because they don't feel that they can. Because in the current climate, you know, there's been a lot said about, you know, don't bother your GP. They're really busy with COVID. You know, and all of this kind of thing. And I personally think that is probably much more to do with it than, you know, a reluctance over infection. Because, you know, if people were able to access telephone consultations or attend anywhere consultations, that takes that element out, doesn't it? But, you know, the fact that people just think they can't bother people, and perhaps feel, I still think there's a lot of stigma attached to mental health issues like depression, anxiety and stress and so on. And particularly at the moment, I suspect people are perhaps feeling some sense of shame and guilt about experiencing those difficulties when, you know, people are, you know, very, very poorly in hospital with COVID, and they're hearing that, you know, cancer patients aren't getting the treatment that they require. So I just wanted to come back with that really and ask what you thought.
I'll just take very quickly. I think I'll give credit to Merseyside that they've been very proactive in terms of building online counselling, online support and telephone support, and did this before COVID, to be honest. So we were in a lucky position. There are many areas in the country that didn't have that set up, and they were there. It's very difficult to predict why people don't come forward. I know Dr. Bliss has got a hand up as well, then, and it may well be that other people can answer that better than me in terms of why people aren't necessarily coming forward.
Sorry, I was on mute. If I bring in Trish, Janet and Melissa to help with that question.
Thank you very much, and thank you for the question, Councillor Clark. I think just to say, we are monitoring actual demand in the services. We didn't see, in fact, the rise, the surge in our, you know, the sort of lower level that you talked about, IAPT, during COVID. We didn't see that demand. However, we have seen a rise in January, and we've started to see that again. Where we saw people present was generally in a crisis, either to crisis teams, the triage cars we've talked about, A&E, presenting at A&E, and actually in crisis resolution teams. So I think this needs further analysis, actually, the work that's going on, as you've said. We don't know whether people stayed, you know, didn't present for different reasons, and we do need to do further work on that. However, as Tom said, with the proactive work that's going on, we're now seeing the increase in IAPT service and, you know, talking therapies, etc. So we are starting to see that from January, but didn't see the demand we predicted at that time. But we have seen, and we did see a surge in crisis intervention. Thank you.
Thank you, Trish. Janet?
Yeah, so I just wanted to agree with you, really, Councillor Clark, is that I think you're right. I think that some people don't want to bother the NHS. You know, kind of, I still get that kind of every day. People, you know, apologising for taking up my time when I'm busy. But you know, kind of that was something when I read it in the report that I was quite surprised at, because it feels to me that kind of a greater proportion of my day than ever is taken up with kind of with supporting people with mental health problems. However, I think on reflection, an awful lot of what the work that we're doing here would probably not really meet the diagnostic criteria for a mental health problem. What we're probably talking about is greater levels of kind of mental distress or chronic stress kind of just exacerbating, and people kind of just tipping over the edge. So people who've always managed their own anxiety and being able to do that with lifestyle measures and things like that are, you know, kind of really, you know, COVID and years lockdown and the horrendous death and destruction is just being, you know, the straw that broke the camel's back. I am referring lots and lots of people to IAP services, but I suppose kind of mainly what I'm doing is kind of encouraging them to self-refer, to use the kind of the self-help resource on there, which are excellent, to use the online self-referral form, which is almost the first stage of therapy. So and I think kind of, you know, by and large, kind of, you know, most of my patients are accessing that. I think it was telling in the report that diagnoses of depression and anxiety have increased by, you know, kind of 1 or 2%, but that's fairly significant. So I think it's multifactorial, but I think that you are right. There are still people who are staying away and not presenting to the NHS with all different kinds of conditions because because of the message at home. Stay home, protect the NHS, and we really need to get the message out there. Yeah, stay home, but you kind of come and see us. We are very much open for business.
Okay, thank you, Janet. Melissa?
Just to echo what's been said, really, I think that this definitely does merit a further look at some of the challenges. We had seen something similar in terms of children's services and access to online. It was to do with the situation in which the household set up and accessing those services and some of the challenges that may present for someone accessing those services. So there are multiple things that we may need to take into account, and it may merit something like behavioural insight for us to have a look at what some of the challenges might be, and we can work in partnership to try and address that. That's a good point. Thank you.
Okay, thank you, Melissa. Can I bring in Councillor Calvin Smeeder, followed by Councillor Sarah Jennings, please?
Yes, thank you, Chair. Can you hear?
Very faint, Councillor Smeeder.
Okay, just to thank colleagues for the presentation. But my ward, Picton Ward, being one of the most diverse wards in the region, so after we have a breakdown of how the pandemic has disproportionately affected the Black community of Liverpool, things like the take-up of the mental health services or access to the mental health services. Do you have a breakdown of that? Thank you, Chair.
Yes, who's going to answer that question? Tom? Yeah. Tom, you're muted.
Just for example, just take psychosis, for example. We've got a lot of data around that. We can provide that sort of information. It can be tricky for some other services because of the measurement issues. We do know that, for example, in psychosis, that before this crisis, that inequalities, there was greater need within certain communities for psychosis services, and we've done a little bit of work on that, and we can perhaps pull together from services like that some information about what's happened over the last, not just the last year, but to compare it with the year before to see whether things have actually worsened. So I'm quite happy to engage with Merseyside around that, because that's relatively easy to do. It's harder for some services to do it in an accurate way, but I think it's possible for that one in particular. And that was an area of concern well before this crisis emerged.
Are you happy with that answer, Councillor Smeeder?
Yeah, but I would have liked some back from our colleagues from Merseyside as well, whether they've got any data on that.
Trish, are you going to answer that one?
Thank you. And thank you for the question. I think we are looking at our neighbourhoods now in terms of access and how they've been affected. I think we'll be working very closely with the CCG on this one, as Tom has said. I haven't got that information in front of me at the minute, but certainly can come back to you with those details. So that's a regular thing that's going on now in terms of impact. Certainly within our services and our BAME staff, clearly, you know, encouraging in terms of vaccination. What we know now is we've had 78% uptake, with an overall vaccination in Merseyside of 82%. So we've still got work to do, and we're doing everything we can to encourage people and help people to get the vaccination. But in terms of access to services and your question, certainly we'll come back to you with that information, if that's okay with you. Yeah, so that analysis and collection is going on at the moment, and we'll work with the CCG on that one. So thank you.
Okay, thank you, Trish. So can I bring in Councillor Sarah Jennings?
Thank you, Chair. So I suppose the report really illustrates that there isn't one fix for anybody, for everybody's problem. There's a huge range of kind of different services that we need, and you know, are being amended to deal with this. And it's absolutely incredible, really. My concern is, not that long ago, this committee had a report on antidepressant use in Merseyside and how it was particularly high, and measures that were kind of being put in place to deal with that. And I'm concerned that people who are presenting, in crisis now, you know, a kind of antidepressants are a kind of quick and dirty fix for an immediate problem. I'm just wondering what are we going to see going forward? How is that going to impact kind of statistics locally? And how quickly can we move people into the other alternative therapies? And I guess my second question was around the homeless cohort, and how, you know, it's fantastic we've been able to get so many people placed. I'm wondering how stable are those placements, and are people staying put because of kind of social distancing and kind of isolation and the stay-at-home orders, or does that not really apply to kind of that chaotic lifestyle? Obviously, when people can move about freely, there's the lure of the open street and, you know, meeting up with people who might have been detrimental in the past to your well-being. But I'm just wondering whether the placements are more stable because people are being advised to stay put. I could be completely naive there. I'm just asking really what the effects are in.
Thank you, Sarah. I've seen indication from Martin and Jan.
Yeah, if I can pick up the issue raised around homelessness, I think you raise some really interesting issues. What we have seen is that overall people have been very supportive in themselves around the accommodation. And what we have also seen is the numbers that I said that we'd moved on into permanent accommodation now throughout the last 11 months is around about 650. We've had very few breakdowns in those placements, because I think what we have learned is providing people with the right quality in accommodation, but also making sure that they've got the right support. And I think it's fair to say the housing associations, because it's housing associations that have done by far the main re-provision, have themselves really said that they are really pleased with the way that it's worked out. We are looking at how we manage this in the longer term and coming up with a proposal with the housing associations, who frankly in the past weren't always quite as inclined to take people who might be referred to as having chaotic lifestyles, because they felt it was very difficult to manage, but they are very clear that that is what they want to do. So I'm sure that some of the restrictions have helped people to come into services, but what we have seen is those that have moved on have been relatively stable. So let's just hope that remains.
Thank you, Martin. Jan, you wanted to come in?
Yeah, thanks, Natalie. It wasn't really to add to anything that Martin said. It was really to go back to the previous point from Councillor Smeda. I think it's one of the things that we've learned a lot about in the during the pandemic, and areas where we know we need to improve, particularly around hard to reach groups. And working with the council and community groups as well, we've managed more effectively to engage in a better way. We've still got more to do. How we communicate as well with particular communities, we've got to change our approach, and we've got to work with communities to understand how information is received. So the stay-at-home message, particularly, you know, yes, that was great, but we still needed people who had serious long-term conditions who needed healthcare to come forward. I think also recording of ethnicity has been a challenge for us as well, because yes, we think we've got the information, but it's not always as accurate as it could be. So there is certainly a lesson learned in terms of making sure that we are more accurate in our recording of ethnicity, because it helps us then coordinate and target communities more effectively going forward. So I think there's a lot more that we can do to improve in those areas, and you know, it's a lesson we've learned throughout this pandemic, both from a testing point of view, but also a vaccination point of view as well.
Thank you, Jan. Can I bring in Sarah Thwaites, then Councillor Jane Corbett?
Come on as well. Yeah, just a few comments relating to one of the previous questions, and also to endorse a lot of the information in the report. It matches really closely with what people have been telling us as their lived experience, and we contributed some of that to the report. On the question of why people might not be coming forward for services, the information we're getting is a whole range of different experiences, because people's life at the moment is very different from each other's. So, for example, if you were a parent trying to homeschool children at home, you are not likely to be wanting to access remote mental health services. If you're living in an overcrowded accommodation, your mental health might not be the thing you want to discuss over the phone or over a video consult when you've got other family members close at home, if you're discussing very sensitive stuff, as well as the obvious issues around stigma and the fact that people are putting things off until they desperately need it. There is also the risk of the COVID concerns. That is definitely impacting on some people in some communities, but probably differently on different groups as to how much that's affecting a fear factor. And finally, we've got our own mental health project that we're doing more research over the next year in people's experiences, and we'll be feeding that into the mental health steering group. That's going to include some stuff that we're doing specifically with specific communities, but also working hopefully with 2 master's students to look at some particular groups, including people with disabilities, and how their mental health has been impacted worse than many other people's during this crisis.
Thank you, Sarah. That's very helpful, and we're quite keen to find out how that research, the findings from that research. So please keep us posted. Councillor Corbett.
Thank you, Chair. A couple of things. Do you think this is the time when we could actually break down the gap between children's and adults' mental health services? Because somehow we've got to do that. And I think children in families, adults suffering from really poor mental health and undermined mental health and emotional well-being, and children all together, there's such a divide still between you're a child, then you become a day over a certain age, and then you're into the adults bit, but you're not into the adults world. It's different. And that's one thing. Could we actually aim for that as one of the next steps? The other thing is, I've been really challenged by the trauma-informed responses. I mean, I know for children it's been around for a long time, particularly in social work, but I just wonder whether we got a chance in terms of looking carefully as part of the next steps, given that COVID has really caused so much trauma to so many people in so many different ways. Could we look carefully at how we could have a trauma-informed approach across all ages? And then the third one, you might not like me for this one, but hey. The third one is, at the start of the next steps, number one, could we look at identifying structural causes of emotional and mental ill health, but looking at the protective and risk factors, and rather than just looking at it in terms of COVID, look at in terms of pre-COVID, because we've gone through 10 years of austerity, pre-COVID, exacerbated by COVID, and then specifically caused by COVID. So going back to what Sarah just said before, being basically trapped in a very small property or accommodation, trying to cope with that in a family is actually not only exacerbated by COVID, but actually can be caused by COVID. So I'm just looking at the pre-COVID. We try to do this with some of the food inequality stuff. Pre-COVID, COVID, exacerbated by COVID, and caused by COVID. Because we've got such a chance here in terms of really changing the whole landscape, which people have already changed the whole landscape. So let's just keep the momentum going, I think. I can see Tom nodding anyway. Well in, Tom.
Thanks, Councillor Corbett. Martin, you indicated?
Yeah, I just thought I'd come back on it, and I wouldn't expect anything less from Councillor Corbett, because I think she's asked, an all-encompassing question, which obviously is going to be very challenging. But I think the issue is right in the sense that, yes, there are some things that are related to COVID, but I think Jan said in a previous response, what it's done is accentuate some things. It's not completely new, and I think one of the issues that probably COVID has in particular we've seen an impact for, I think for everybody on this call, is the isolation, the lack of social contact, and the fact that as human beings, I think it was Trish who said, and I'll certainly talk about my own mum as a good example, somebody with dementia actually needs that physical touch, but they also need somebody who can engage them and intellectually stimulate them and so on. So I think there is an opportunity for us to look at the whole way in which we promote mental well-being rather than focus on mental ill health. And I think the issue is, how do we recognise that for a lot of people who've got an underlying predisposition maybe to poor mental health, a lot of the issues are the same as they are for the rest of the population. And Jane leads some fantastic work across Liverpool on this. We know the impact of deprivation and poverty themselves have a major impact on people's well-being, because you don't have as much resilience, you don't have as many options, and you often feel that life serves you a very poor set of chances. So I think you're right, Jane, in that mental health, and I think it's part of the reason for our strategy across health and social care is, yes, we need to have a focus on mental health, but at the same time, mental health is in everything that we do. So it's in how people are treated. If you go into hospital for a physical health issue, there's a massive mental health element to it and psychological impact. We know that certain conditions are going to have certain prevalence and so on. But I think the issue that has come across for me in all of this is the opportunity to connect people up, the opportunity to reduce social isolation, and I think how we could ask people what they found useful, because I think that there are some interesting challenges which we talked about earlier on. We didn't see maybe the take up in certain services, but maybe that's because if you're dealing with other things that are causing you a bigger problem. So I think the way that we've provided a broad range of support to people, one of the issues is trying to find out what things have made the difference and what things would have made it better.
Thank you, Martin. Tom, you wanted to come in?
Just a very quick one to get in terms of Councillor Carter. A couple of things. One, I suppose, in terms of that biopsychosocial approach in the first slide. I mean, we did something like that 15 months ago before all this kicked off. The red on that original slide, and probably whether you noticed some of them were red, those reflected your points exactly. Some things which have actually gone up the scale in terms of their impact. They were always there, but they've been accentuated, and some of them are new. There's a couple of new ones on there, long COVID and so on. But just in terms of the trauma side of things, and just an example, we've been involved in developing a pathway of personality disorder. Now, personality disorder is a term I detest, actually. It's not my favourite term for calling people who are quite often the subject to abuse in childhood. But 80-85% of the evidence suggests that is rooted in childhood in terms of things like abuse and so on. what we need to do, and you quite correctly there in terms of trauma-informed approach, is respond at that age, and we'll never know whether we're successful, because the tree you plant now is something that grows in 30 years' time, or doesn't grow in 30 years' time. So the work that we do when things happen, and that involves the police, it involves education, it involves all sorts of other partners, actually prevents these things emerging, and they quite often emerge when people are in the 30s and 40s, when the damage is done, and the damage has been done a long time before that.
And the all-age approach, Natalie, right the way through, an all-age approach to mental health and mental health support. Anybody going to put their hands up and say they'll do that?
Okay. Can I bring
Absolutely,
in Elaine,
Jane,
please? If I can bring in Elaine and then Jan.
I can't answer the all age support, Councillor Corbett. I wish I could. It was the point raised earlier. Let me turn my microphone up. It was a point raised earlier around suicides, and if you think about the 2008 financial crisis, suicide numbers peaked nationally in 2012. So it took 4 years for that to play out in terms of actual peaks in suicide numbers. And that's something we're very mindful of. You might be aware Merseyside instigated the Zero Suicide Alliance, and it's great that the training's being rolled out. But this is something that sort of, I think the challenge on the joy and equal measure of the pandemic has been how it's forced innovation. It's forced us to come together and blast through some of the perhaps structural barriers, and that's the stuff that I think we really need to keep, because if you keep that 4-year timescale in your mind, that's something that we have to avoid. So anything that we can get out of this that's a positive is actually that closer working. But there is a tail on the development sometimes of mental ill health and suicidality in particular. So if we need a sort of a milestone in the future, we don't want to see suicides peak 4 years from now. Absolutely, and this group and the joint working we've seen between all of the agencies, particularly I think Liverpool City Council, will be instrumental in making that absolutely a reality.
Thanks, Elaine. Jan, if I can bring you in.
Yeah, just in terms of Jane's comment about, our services should be age appropriate, and we shouldn't have barriers to access just based on age. Yes, we have some legal requirements, and we can manage that, but we should be treating our individuals, our families, our communities appropriately. And we should wrap around services that are appropriate to meet the needs, irrespective of the age. We have to be cognizant of the law, but we can do this more creatively. But I absolutely agree with you.
Yeah. Thank you, Jan. And obviously from COVID, we've learned how to work collaboratively. So there's no reason why through children's services and adult social care, because the family is a unit. What impacts on a child impacts on their parents. And if they're not able to get that support, it further exacerbates situation. So no, thank you for the report. Thank you for all the questions. Really, really good. I have 2 questions, obviously. In regard to the complex needs, what are the range of ways in supporting people? I know they said, I think Trish, you mentioned there are several ways, but I'd like to find out what are some of the ways as elected members it's helpful for us in terms of disseminating that information to the community. And that was in relation to people who were not digitally capable in terms of getting that information. I know the phone, but what others?
I can take that one. Part of my responsibility at Merseyside is communications. I keep turning my microphone down. So we clearly are absolutely cognizant of digital deprivation. I think going back to the Attend Anywhere conversation, which was really interesting, absolutely agree. Some people prefer Attend Anywhere, and obviously if you're digitally enabled, that is a tool that might be appropriate for you. But as we've said before, part of the skill of our clinicians sometimes is to make sure that people are safe, make sure that they're okay, make sure that their home is safe for them, that they're eating well, and all of those things you can perhaps lose in a digital environment. I think the use of telephone, one of the things we're doing in terms of use of telephone, we've had a high degree of use of telephone And one of the things we're checking back in our own research with our service users is that it isn't the bias of our staff that like to use the telephone, that it is actually the choice of the service user who are able to access the right channel for them. I think there's lots of great programs going on across Liverpool in terms of digital deprivation, but it's a journey that we can't slow down on, because so many services, COVID will play out in the way that it does. It will become an annual thing probably in terms of your vaccination. We don't want this to come back again. We certainly don't want to go back into another lockdown. So use of digital and the wider use of digital will be a priority. It certainly is at Merseyside, but it's how you do that mindfully, and how do you link into those deprived communities that don't have access. So what can we do together to widen that access wherever possible, to give people absolute accessibility to services when and where they need them. And I think there's not an easy solution to that, but I think collectively we have it within our gift, going back to that, collaborative working and blasting through some of the barriers that we've seen over the last year. Digital access is going to be one of those areas I think that we collectively could really usefully focus on.
Yeah. Thank you, Elaine. If I can come back on that before I bring Jan in, obviously in areas where there are high levels of poverty and social deprivation, that digital inclusion is another barrier, because if it's either heat or eat, then having internet connectivity is not going to be a priority. So while we're moving forward with digital inclusion, we need to be mindful that some families may never be able to afford that, and it's how we ensure that we're not further widening that gap.
Absolutely. And how we prioritize the closing of that gap at the top of the list, I think.
Thank you. Jan?
Yeah, I think the learning from rolling out testing, where we had a national booking system, and even I think nationally they were surprised at some of our areas where nearly 20% of those communities couldn't access because they weren't online, or they didn't have a phone. And how do you get your test results if you haven't got a mobile phone? So we did have to be creative around working with our communities in terms of how to make sure that information was accessible to them. So we do have quite a lot of learning and quite a lot of innovation in dealing with some of the challenges that we've got. It's how we use that to make sure that we, continuously test ourselves to say, are we as accessible as we think we are? Because we can't have a one-size-fits-all approach. So this is one of the points I've got from the whole experience of trying to run services in the city over the last 12 months. Is we do have to get better at learning and listening to our communities in terms of how they access our services. So we've got some positives out of that, in terms particularly how we've used and worked with community groups, but there is still more to be done.
Brilliant. Thanks, John. And I'm glad you said that. And I know you mentioned hard to reach communities, and I always sort of cringe when people say hard to reach, because I think they're not hard to reach. It's just our way of engaging is not effective. And it's about, and as you said, you've learned quite a bit, and it's taken that forward. And in terms of early intervention to prevent those crises later on, and coping strategies, within the GP practice, within community organisation, just sharing information about coping strategies and just giving people that voice. Thank you very much for that. Are there any other burning questions? No. So if I can invite Councillor Ros Gladden just to summarise, and then Councillor Claire McIntyre, please.
Thanks, Natalie. Thanks, Chair. It's been a really interesting evening, and I want to thank all the officers that have worked so hard during this period. We're so very fortunate that we've got them. Tom Fairclough has been a great support to me during the time that I've been doing this job. He's so inclusive, so down to earth, so just, so that you can understand the very basics of it. I'm not a clinician, so sometimes it goes a bit above my head, but Tom always makes sure I understand this. So we've got some amazing officers. I'm really grateful for that. This discussion tonight has been superb. I have to say, Natalie, thanks to you for bringing this to us. Mental health is going to be something that impacts us for a long period of time, poor mental health, particularly in our deprived communities. And I think we need to keep that, that learning has got to continue. We're learning things all the time. what Jane said in particular about the age group and the difficulty, you know, that transition period between children and adults is still not good. 10 years ago it wasn't good, and we still don't seem to have moved any further forward on it, so we need to be looking at that. So I just want to thank you all for doing this tonight and being so able and so open, just to make sure that all the slides can go out. If we can ask Peter and all the officers to send the slides out, that would be a great help. So thanks very much. Thank you.
Thank you, Councillor Gladden. Councillor Claire McIntyre.
I haven't got much else more to add apart from just to say thank you so much. It's just been so good to see all this joint working and to see all these partners working together. It's been so positive, and really just to thank everybody on all the council and select committee as well for all your brilliant, outstanding questions. Of course, you know, wouldn't expect anything less. And obviously, I'm happy to take back any specific issues that anybody wants to bring up to Councillor Brandt, who is the Cabinet Member for Health. Just once again, thank you all very much. It's been a very positive discussion. Thank you.
Thank you, Councillor Claire McIntyre. So during the discussion, Councillor Corbett, you suggested 2 further recommendations, which Peter took note of. So if Peter can read it out, and we can move forward if members are happy to add this to the recommendation. Peter?
I might just get Jane back in here because I'm sure she'll correct me anyway. But I had it down about bringing mental health services together for children, young people and adults, which I think we've was acknowledged by Janet anyway, wasn't it? And then it was the structural. Jane, do you want to come in on this? I can't understand my own scroll here.
Well, you can't understand me either, probably, Peter. So the other point was the trauma-informed responses, given that we're looking at COVID in children and adults. But then the other one was, so the wording I've got is part of number 1, Peter, on the next steps. Identification of structural causes of emotional and mental ill health, including chronic stress, including protective and risk factors, but looking at pre-COVID, exacerbated by COVID, and caused by COVID.
Right, that's fine. So we'll add them into the next steps, which is part of the recommendations. Thank you.
I'll keep it written down, Peter, if you need to come back to me somewhere.
Thank you.
Are members present happy to include? Sorry, I was on mute. Are members of the Select Committee happy to include the suggested recommendation? Brilliant. Okay, thank you very much. So can I move that the recommendations are set out in the report with the addition of Councillor Corbett, 2 suggestions are agreed? I see some nodding. So agreed. Councillor Corbett? You're on mute.
I know. Sorry, Natalie. And also, we were thinking, weren't we, about having a quarterly report here somewhere. I don't know how, what'll happen in May, but just keeping this whole issue on the agenda so we don't lose it would be really helpful, to be honest with you, whoever is chair of Health and Social Care.
Yeah. Can I bring Martin in and then I'll reply to that? Martin?
Yeah, I just also wanted to recognise the work that had gone on in pulling this together, but particularly to thank Andrea Asprey, because Andrea took the lead role really in pulling it together. And in my experience, trying to pull together a load of professionals in their own organisation is difficult. Trying to do it across multiple organisations, I think it's just that I would want to recognise and thank her for that work.
Thank you, Martin. You said exactly what I planned to say at the end. So thank you for that. It's been really, really, and it shows again, working collaboratively, how much more effective we can be. Councillor Corbett, so yeah, I totally support, and I think members present would be happy to see this mental health kept on the work stream so we can have regular update, because it's not just COVID when there is a crisis, mental health crisis. It can be any day of anyone's life. There's a thin line between having a crisis and not having one. So if you're happy, we can put that on the work stream going forward, to come back to the committee again with officers giving us an update on, you know, what we've learned, what they've learned, and what other strategies implemented going forward. Okay, so if we can move on to item 4, question time. I can advise there are no questions submitted to the committee. Okay, and item 5, there was a motion submitted by Councillor Alan Tormey tackling loneliness. However, Councillor Tormey, neither Councillor Kemp are in attendance. So the motion will fall as there's no one to move it. However, we've had a great discussion about mental health and implementing different strategies and going forward. So obviously, because neither councillors are here, in line with committee guidelines, this motion will fall. Okay. So moving on. So we've had Councillor Jennings with us for over 6 years, and sadly, we'll be losing her. So if I can bring Councillor Jennings in, and then I will say a few words.
Thank you, Natalie. It's been an absolute delight to be on this committee, and I've learned so much and had the opportunity to ask some very intelligent people some very sensible questions, or maybe not so sensible. So thank you all for your learning and your hard work, because it just shows how much goes on in this city that we can learn more about all the time. I'd like to just say a word about the previous chair, who was amazing and incredibly patient and generous with everybody on the committee, and always made time to give people a chance to ask questions. And Natalie, I think you deserve chair next year, so I'll put a good word in for you before I go. You'll do a brilliant job of it if you choose to take that up. So yeah, so thanks everybody, and yeah, I shall miss you. It's the only committee I'm saying that to, by the way.
Thanks, Sarah. Thank you, Sarah. And I'd just like to place on record on behalf of this committee our thanks to Sarah. And you know, people think opposition parties and the ruling party cannot work together. Sarah has, you know, shown on this select, basically united for the greater good of the city, we can work together. And you know, the information, the work you've worked with us has only helped residents in the city, and you will be missed. And we just say, you know, feel free to come back. You know, you can be you can come to the committee even though you're not a member. Thank you very much. Okay, so again, can I thank all of you for attending, and to formally close the meeting. Thank you all. Keep safe and see you soon.